Good afternoon. My name is Linda Samost. This is Mercelyne Latortue, and we're from Sunday Suppers. I just first like to thank Nick and team for this opportunity and for all the support we've gotten over these weeks. It's really changed It's really changed kind of how I perceive moving forward and visioning, and as well as Robert Wood Johnson for supporting me in this process. So I would imagine that many of us have gathered around tables like this growing up to share a family meal. But in today, less than half Americans do that. So at Sunday Suppers, what we do is we use the family meal and all of its attendant benefits to change and enhance people's health and well-being. It's a little different what we do because we really work deeply with families to make lasting behavioral change that will impact health outcomes such as diabetes and obesity. So what we're trying to do and what we've learned from our pilot is that we'd like to expand. First, we'd like to build a sustainability model, as Oliver was alluding to earlier, and also to expand to 2 additional sites. So in Philadelphia, of course, one of the poorest, hungriest cities in the nation, and nationally, of course, and in Philadelphia, obesity and diabetes are growing at an alarming rate. We're in North Philadelphia, where a lot of our families are struggling with access to healthy food and affordable food, but also so many other daily challenges are facing them. These are some of our partners. They provide food donations, weekly programming that we provide to our families each week, as well as research and evaluation. So family meals, a lot of research on family meals. They improve communication among family members. Kids who eat with their families are more self-confident, have greater self-esteem. They also do better in school. And meals made at home are usually lower in calories, lower in fat. They actually taste better, and so that impacts your health outcomes as well. So what is Sunday Suppers? Sunday Suppers is a program where low-income families who have at least one minor child gather around the table and share a healthy family meal. It's in a restaurant-like setting. They turn off their phones, that is a requirement, and are asked to try everything. Okay, so then in addition to that, how do we support them making behavioral change? We offer programming such as hands-on cooking demonstration, nutrition lessons. We do not do nutrition education. All of our programs, the key is that they be fun. Okay, we also do exercise such as yoga, Zumba. Our families love that. And at the end of each dinner, our families leave with a to-go bag. And in that to-go bag is everything that they need to make a healthy meal at home. So we're showing them the meal, they're trying it, and then they are having that experience at home. Also, we have a community garden. We just started planning that, and that is going to be a key way for our families to get fresh and affordable food. So our families are low-income families in North Philadelphia with at least one minor child. They're all on SNAP benefits. And when we talk to our families, they all want to make changes. They all want to be healthier, but they don't know how to. They might not have the resources or the skills. So we at Sunday Suppers, we provide them with that information, with the skills, and help them create reasonable and attainable goals so that they can make the changes that they want to make them and their families healthier. What is our plan? Our plan is to expand into community health centers and into schools that have health services. And the benefits to this are going to be that we will be able to have them refer people who are at risk for obesity and diabetes or who are dealing with that into our program for us to collaborate with them and then to better measure behavioral and biometric change. As I mentioned, we had a pilot. It was about a 2-year pilot, and what we saw there really amazed us. And we recently finished our 9-month follow-up, and I was ecstatic because, as you can see with family meals, when we first talked to our families, about a third of them were eating together about a third of the time. While they were in the program, that increased, actually doubled. But what really makes me feel very hopeful is that they continue to eat together even after leaving the program. Conversely, with fried foods, which we try and help them learn how to cook differently, they reduced that by half while they were in the program and then again continued to reduce that afterwards. Our families did eat more fruits and vegetables in the program, both in the program and at home. That declined somewhat, although it did not revert back to baseline levels. We only serve water at Sunday suppers, and we really are trying to get our families to choose water instead of sugary drinks. And when we say sugary drinks, we just don't mean soda, because there are lots of other things our families are drinking that have much higher sugar levels. So everyone in our program has reported drinking more water. And I'll just tell you a really quick story about Raquel, one of our moms. There's so many stories, so many success stories at Sunday suppers. Raquel was a mom who was actually brought in by her son, who found out about the program, and she was very quiet. After we kind of gave her a couple months to get more acclimated to the program, she reluctantly told us that she was drinking about a case of soda a day, and that she really wanted to change that. So we worked with her about setting a realistic goal. What we came up with was her halving that amount. And what happened is that a couple weeks later, she came in and she reported that she was down to 3 sodas a day and had lost 10 pounds. And these are the kind of changes that we are seeing with our families as we provide Sunday suppers to them. Of course, the costs associated with diabetes and obesity are significant. So as our families are making these changes, we expect improved health and the attendant lower costs associated with that. As I said earlier, we're asking for $125,000. We really need help with a sustainability plan. It's something I really struggled with during the lab, and I can use some help and support in trying to create that, because I really believe this works, and I want to expand it to as many communities as I can. And then also expanding to the 2 additional sites with the health outcomes. So Sunday suppers, it's an innovative program. We're changing people's lives. We're changing their physical and behavioral outcomes. Please help us help them. Thank you so much.